Allergies, asthma, and eczema are the subjects for today's show. I'm Dr. Scott Fuller. I want to talk about conservative solutions for these problems and disorders. And this is a fairly common reason that people bring their children in to come and see me in my chiropractic office in Woburn, Massachusetts. And we'll talk about how the chiropractic solution can help children and adults with these problems, how it works, the neurological effects that we have with chiropractic care. As we go along with this show and subsequent shows that I'm going to be doing, I'm going to be building a case for how chiropractic can be useful for you and how you should think of chiropractic care for you and your family moving forward. Chiropractic is so much more than just neck pain relief and back pain relief. So many people have that concept that that's what it's for, and it's so much more. And people will come in for neck pain and back pain, and that's a common problem, and we're very good at it. And they'll stop coming when the pain is gone. And I'm going to make very strong cases moving forward over the next several shows of how that's very short-sighted, and we can do so much more for you and your children. So asthma, allergies, and eczema. And as I say eczema, we can include other skin disorders, psoriasis, and so forth. I'll just use the word eczema moving forward. What I'd like to do is start with a few cases in my office that have really responded well to chiropractic care and a couple of other ideas that we've done in the office. First off is Caitlin. Leslie and Larry brought 10-year-old Caitlin to my office after being referred by another chiropractor. She had severe asthma since age 2.5 with multiple allergies and eczema. She had seen multiple doctors and had been on many different medications, which probably sounds familiar to you. After 2 chiropractic treatments, Katie's vital or lung capacity improved from 220 to 280 milliliters. Simply put, she could get more air in her lungs after 2 sessions in my office. And in 1 month of chiropractic care, her capacity improved to 325 milliliters, so quite a big improvement of how much air she could get in her lungs. Her skin improved after significantly reducing her dairy intake, more on that later. And after 5 months of chiropractic care, her updated pulmonary tests at Children's Hospital were better than ever. And again, she was struggling since age 2.5, and now she's age 10. After 8 months of care, she was able to eliminate the 16 pills she was taking every day. She did have periods of difficulty moving forward, but overall her condition improved greatly. Her mom, Leslie, wrote, "What has happened to Katie's asthma is nothing short of a miracle." Do you want to know why I show up to my chiropractic office every day? It's for the Katies. That's what wakes me up and gets me out of bed in the morning and comes to my office. Dealing with insurance company and doing paperwork and all this other kind of stuff, no, that doesn't excite me. Having somebody like Katie get so much better is what keeps me going each day. Next is Jessica. Jessica was brought to me at age 3. She had chronic cold since birth. She was diagnosed with asthma, and she had some UTIs. She was on for medications, Bactrim antibiotic. She was doing that for 3 to 4 months, twice a day, before coming into my chiropractic office. Amoxicillin was tried, but it didn't work, and she had allergies to amoxicillin. She was on an inhaler, Pediapred steroid she was taking, and she was taking a generic form of Claritin. So she had a pile of medications she was taking every day at age 3. Her mom mentioned to her allergist about taking her daughter to a chiropractor, and the physician replied, "We don't believe in them," which means we don't believe in chiropractors. More on that later. Anyways, after 3 chiropractic adjustments, the Bactrim was cut down to once a day. She had a flu shot, by the way, and then she became congested and stuffy and coughing afterward. We'll do a show on flu shots later on. Actually, I did a show on that in the past. After 9 chiropractic adjustments, she was off all of her medications, except for the Bactrim. After 11 adjustments, her Bactrim was again cut in half. After 12 adjustments, her runny nose had completely stopped. After 16 chiropractic adjustments, the Bactrim was stopped. Now, she did go on Bactrim in the future off and on over the next couple of years, but was much less frequency than in the past. After 6 months of care at once or twice a week, more on the frequency of adjustments later on, she was doing well, the congestion was gone, the runny nose was much better. Her coughing was the last symptom to go away. That gave her struggles off and on over the years. But again, what her parents would do is if she had coughing trouble, they would start with chiropractic as opposed to just rushing to the drugs, rushing for more pills, rushing to the inhaler, more antibiotics, which would lead to more problems and so on and so forth, and just perpetuate the issue as opposed to getting to the cause. After getting a few adjustments in the future, her cough would clear up and so forth. At the 1 year point, back to the allergist, and the MD once again said, I don't approve of chiropractic care. Well, mom stepped up and said, but my child has been less sick and is taking much fewer medications under chiropractic care. So she stepped right up and told the doctor that. So that was interesting. Jessica's been under wellness chiropractic care ever since. What was memorable about Jessica is because mom and dad were so impressed with the results, they would tell everybody, hey, your child is sick? You remember how sick our child, Jessica, was? Try a chiropractor. Next person, try a chiropractor. Next one, try a chiropractor. And she was always amazed at how few people would actually give it a try. Kind of sad. Next up, this is Abby. I have this testimonial on my website. Thank you for your advice and information you sent to me of milk allergies in children. Now, Abby's not even a patient of mine. This was some advice sent via a friend. Since Abby was 9 months old, coincidentally the time I stopped breastfeeding, she said, she had been struggling with repetitive ear infections, colds, allergy symptoms, constant runny nose, waking up coughing, and various other ailments. Again, sounds familiar, right? It seemed that she had to stay home with her 1 to 2 days per month because she was getting too sick to go to her sitter. She turned 2, and it's been a long year. During that time, we had numerous visits to the pediatrician and an allergist, just like Jessica's case. I knew there were allergies as mom suffered with allergies bad enough to require shots. We switched her to organic soy milk at the age of 12 months. She bought HEPA air filters for her room, a new vacuum with a HEPA air filter, put cheesecloth over the vents in the room. This might sound familiar to a lot of you with a sick child, trying to just make the atmosphere in the room a little bit better. Removed stuffed animals, changed her sheets every 2 to 3 days, and so on and so forth. Things improved marginally with all of this intervention, but certainly not enough. We then tried a variety of medications per allergist recommendations, Zyrtec, Flonase, Nasonex, and so on. Some helped for a little bit, but it was difficult to give the infant, toddler, all of these medications, and they weren't really helping. On May 1st of the year when she got this information, Abigail was 2 years and 2 months old. She decided, with my information, to take her off of all dairy products. More on that later. And this is an important hint as we move forward in the show. Per my advice, there were results in days. Within 3 days, her runny nose eased up to almost half of what it was been. Within 5 to 7 days, her waking up in the middle of the night coughing completely went away. Within 10 days, her runny nose was gone. The dark circles under her eyes lessened considerably. She had not been sick once this month or had an ear infection, which were very common prior to removal of dairy products. So this child didn't have chiropractic care at the time, just the elimination of dairy products. Big hint there. It's now been over 1 month, and I will not go back to having milk in our diets. She's never had behavior problems before, other than what I would have attributed to normal kid stuff, but it's amazingly better behavior since of being off of dairy products. She also sleeps better. How do I thank you enough for providing the information that got me off the fence? Both her pediatrician and allergist think I'm taking it too far and depriving her of foods that are normal. I was also told by the doctor that some kids are just prone to being more sick than others, but here's just a great answer and a great solution to that child's problems. Very impressive. The next case is case Leanne. She's an adult now. She was about 30 years old when she came into my office. Now, just like a lot of people, they don't know it's so important to bring their children and themselves into a chiropractic office for asthma and allergies and eczema and so forth. But when they're in the office and we whip the magic on them, they start realizing, gee, not only are you helping with my back pain and sciatica, like Leanne says, but can you help me with something else too? And people will often notice that their allergies improve without me prompting them to figure that out, or their blood pressure comes down, or their gastrointestinal symptoms improve and so forth. Now, it's not that the chiropractic cured that. What we did is what we'll talk about in a few minutes. It's improvements of the nervous system and immune system, simple. So, Leanne was reluctant to come into the chiropractic office like a lot of people, but she was dragged in by a couple of patients, and her lower back pain and sciatica started getting better in just a couple of weeks. Then she said, Dr. Fuller helped me in other areas of my health and wellness as well. I had been battling severe seasonal and animal allergies for years, and at one point she was on 2 medications just to make it through the day. Now, the medications weren't creating a solution for her problems, they were just lessening the symptoms temporarily. Dr. Fuller explained that consumption of dairy products can lead to more severe immune system responses to allergens in the environment. I advised to do that, and sure enough, she eliminates the dairy products from her diet. Her allergy symptoms go away. She's off of her medications, totally impressed. She sent in her husband. Her husband has seasonal allergies. I told him, you know what to do. He says, you betcha. The next spring, her husband gets off of all of the dairy products. Sure enough, his allergy symptoms go away too. So now we're leaning onto something. We can see here that there's the chiropractic care making some improvements, and there's also elimination of dairy products. Here's another case. This one is not strictly about allergies. This is Evan, also on my website. Now, Evan was brought to me with a variety of symptoms: nonverbal learning disorder, dyslexia, dyspraxia, chronic illness, headaches, and unable to run. So he had a variety of problems. Dr. Fuller, we wanted to thank you for your role in helping Evan become a normal, healthy 11-year-old. Prior to seeing you a year ago, he was weak, chronically sick, and suffered from emotional problems and learning disabilities. Pediatricians unable to figure out why the immune system wasn't functioning properly. Now that's why I bring him into this show, because it's about his immune system. And that's what's going on with asthma and allergies and eczema. It's an immune system phenomenon. They kept prescribing more and more antibiotics until he wound up in the hospital with serious stomach disease from all the antibiotics. He was getting daily debilitating headaches. His legs were so weak he couldn't run, and we didn't get answers medically. The regular chiropractic adjustments and prescribed exercise, along with a change in diet, which was elimination in dairy products first of all, and nutritional supplements you recommended, have changed Evan's life. He is now happy, confident, and well. The balance and coordination exercises have been so successful, he can now juggle. The supplements seem to keep his immune system strong. There's another hint. And the adjustments have cured, she used the word cured, now I don't use that word, cured everything from swimmer's ear to daily headaches. Thank you for the intervention, and he's doing great. So there's another message here: chiropractic adjusting and elimination of dairy products. So very impressive improvements with a lot of people. So, step 1, what do? If we have problems with asthma, allergies, and eczema and other skin problems like psoriasis, step 1, try chiropractic care and eliminate dairy products. Now, if you are reluctant to come into my office or a chiropractic office anywhere to try this for your child or for yourself, then at least start step 1, eliminate dairy products. Anything from a cow. And that does not mean go for lactose-free products. You probably have a sensitivity, now I'm using my words carefully here, not an allergy, a sensitivity to the milk protein, which is the casein, the milk protein. That's why you have to eliminate the products altogether. Nothing from a cow. And I recommend a trial of 2 months, 0 dairy products. You cannot just cut down and expect results either. The reason I say that is, if you have a peanut allergy, how many peanuts are you allotted per day? 0. So if we're going to do a fair experiment for you or your child, you need 0 dairy products. So when you get to day 1 with none, that's when the clock starts ticking. And you want to do that for 2 months. See what happens. 0 dairy products. So you have to kind of gear yourself up for this too. You might need to change over what's in your fridge and your cupboards and so forth. Be prepared. It might take days, weeks, months to lead up to that point where you're going to be 0 dairy products for a period of time to see if it works. Follow? So do that and see what happens. I also suggest to people, keep a diary. Keep a diary of what's going on. So even if it's just a sentence per day, you write down day 1 on December 18th or something. I'm going to stop dairy products today, and today I have runny nose and allergy symptoms, or my child still has asthma and using the inhaler twice a day. Next day, no change, and so on and so forth. Day 7, fewer allergy symptoms, inhaler used less, and so on and so forth. Just keep a daily record of that. You can type it on the computer, write it on a piece of paper, whatever you want to do. But just keep a diary of your symptoms or your child's symptoms. And if you're doing this with your child, you probably want to do it yourself so you can work together, right? You want to work together, and so if they're going to be off of dairy products, you're going to be off of dairy products. So thinking about this, is your child, because a lot of people will then pop several questions to me at this point. So what does my child need to supplement? Are we missing calcium? The answer is no, and there's a lot of research that says taking in a lot of dairy products does not protect your bones. In the United States, we take in a lot of dairy products per person, but we have one of the highest rates of osteoporosis in the world. In other countries around the world that have little or no dairy product intake, they have much stronger bones. So that's just a simple piece of information. We also take more calcium pills in this country than anywhere else in the world, but we have high rates of osteoporosis. So there are other things, and I'll do other shows on osteoporosis and protecting your bones and the strength of your bones and so forth. So you're not missing anything by taking dairy out. It's not like you now need to substitute with some supplements or other foods. You think about it, dairy products are made for baby cows. And when baby cows become adults and they become weaned, they don't even take in dairy milk anymore. They move on to grass. Adult humans, when we get off of breast milk, we move on to other foods. Every other animal weans off of milk and move on to something else. So once again, we're not missing anything. But you just might be missing a lot of symptoms like allergies, seasonal allergies, eczema, psoriasis, and asthma. Great start. Part 2 of that is do the chiropractic thing. So get a chiropractic evaluation, even if there's no pain, and that's a key point. I always encourage people to get a spinal evaluation and work your nervous system and work your brain and work your immune system, even though you don't have any pain. That's the best time to come. Very similar to bringing your car in, even though it's running fine, and you get a tune-up and an oil change to keep it running fine. You bring your teeth to the dentist, you bring yourself to the dentist, and you get a dental checkup and a cleaning and so forth, even though your teeth don't hurt. And you brush and floss every day. So we're taught to do these maintenance things. Same thing with your spine and nervous system. Try the chiropractor. So that's what you want to do. Now, why is that? Is there any research besides these case studies that I just told you about that? Yes, there are many. We don't have enough time to get into them all, but I'm going to tell you one of the best articles. This is in 2004. The title of the article is Relationship. Now follow the words and I'll explain. Relationship between vertebral deformities, think spinal misalignment, vertebral deformities and allergic diseases. Peppered in this article, they will talk about eczema and asthma and rhinitis or runny nose and so forth. So basically all the symptoms that we're talking about right now. Asthma, allergies, seasonal allergies, frequent sinus infections, runny nose, eczema, psoriasis, skin problems, and so forth. That is all in this article over and over and over again, so I don't have to keep repeating it. So again, the title of the article in English, Relationship between Spinal Misalignments and Allergies. Excellent. The Internet Journal of Orthopedic Surgery in 2004. There are just gems of information in this article, and I'm going to cover a few, and then we'll talk about what else you can do. So they start off, chiropractors and other medical practitioners have presented evidence of a relationship between spinal misalignments, right? And sympathetic segmental disturbances secondary to visceral disease and immune dysfunction. Whew. Wow, what did I just say? A relationship between spinal misalignments and the function of your immune system and your organs. You see, the take-home message is simply this. If the spine is off, your nervous system becomes dysfunctional. If your nervous system becomes dysfunctional, it affects blood supply, organs, and the sympathetic nervous system, which affects your blood supply and organs, okay? Everything is connected. That's what the article is saying. These authors report on positive results of a controlled study of the correction of spinal misalignments in patients with atopic dermatitis, eczema, and bronchial asthma. They also talk about allergies in here too. So here's the simple statement. There's a relationship between guts and immune system and chronic spinal misalignments. Now, spinal misalignments are two things, just for your information. One, as I've been showing you on the screen here, is a big misalignment like this. This would be more of a global misalignment. It's easy to see, posture can give us. But then there's also segmental misalignments. One bone has a problem with the next bone. Even though your posture looks good, you can still have misalignments. Even though the car in the parking lot looks good, it might not start because the battery's dead or there's no oil in it or whatever it is, okay? Even though it looks fine, there can be other problems inside. So you can have segment problems and global problems, and most of us have both. In your teeth, you can have one tooth that's a problem, or you can have many teeth. Most of us have both, right? So that's what's going on. Listen to the improvements. Now, they took a whole bunch of people, thousands of people, put them under correction for the spine misalignments. Here's the results. Correction of the spinal misalignments improved the itching symptoms of eczema by 88%. Wow. Correction of spinal misalignments improved the skin appearance of eczema by 72%. This is skin healed up. Allergy symptoms improved in over 70% of patients. This is a key point. This is so important. This is important if you come into a chiropractic office with pain, with headaches, with migraines, with allergies, asthma, skin problems. This is the important point. Follow me now. These improvements were only observed in patients that were treated daily for 3 to 6 months. The point is this. It was a lot of treatment. Daily for 3 to 6 months. If you came into me daily for 3 to 6 months, and by the way, some patients do because they're really in bad shape, insurance isn't going to cover that because they're only going to cover 12 visits in my office like they cover physical therapy in almost all cases. Okay? But keep in mind, too many people, when they start chiropractic care, they don't give it enough time and they don't come enough. If I'm your personal trainer, am I going to say, I'll see you once a month, that'll be enough? No way. I'm going to say, if you're going to see me once a month, you're going to be working out 5 days a week on your own, and then I'll see you once a month. Or they're going to say, you're going to work out 5 days a week with me, and so on and so forth. If you sprain your ankle and you have a freshly sprained ankle, the physical therapist is going to say, I'm going to see you 3 times a week. If you're a pro athlete, you're going to be seen 3 times a day. Okay? So this kind of frequency is what these researchers said was the key to getting these spinal misalignments improved, stimulating the nervous system appropriately with the work. And if you stimulate the brain and nervous system appropriately, the immune system goes back to normal, the blood flow to the organs goes back to normal, and the nerve impulses to the organs, including the adrenal glands in this study, goes back to normal, and people heal up 70%, 72%, 88%. Imagine in this study, now this study was only correction of spinal misalignments. Imagine if this study added elimination of dairy products as an example, okay? And then it goes on and on. The study continues. The dermatitis, the eczema patients who did not receive spinal correction treatments every day, there was no improvement. So if you didn't come enough, you didn't get better. Let's see, there's just some gems in here. The study confirmed that over 98% of allergy patients had spinal misalignment. So 98%. Essentially, everybody with allergies has spinal misalignments. Let me ask you a question. Does everybody have calculi and tartar on their teeth? Yeah, it's a pretty safe bet, huh? Maybe there's 1 in a million that doesn't? Because we all use our teeth. Do you think everybody has a spinal misalignment? To a certain extent, everybody's going to, because we use our spine every day, our environment is not perfect, our ergonomics are not perfect, the way that we use our body every day is not perfect, and so on, right? So, yeah, we have spinal misalignments, they're very common. Patients with allergies, skin problems, and asthma and hay fever have a high ratio of these chronic misalignments. This is an important point too as we talk about what you need to do at home to help your in-office chiropractic care. The muscular system that supports the spine was in noticeably poor condition in the eczema and asthma patients alike. So not only was the spine out of alignment, the support muscular system was terrible. So what they're suggesting here is you need to do exercises to support the spine. Guess what all my patients get? Exercises. And you've seen that many, many times on this show. The patient must improve the muscles. This is such a gem statement. I need to tell you this part. The patient must improve the muscles supporting the spine and engage in sufficient sleep, active stress reduction, and nutrition to improve basic physical strength, immunity, and resistance for the recovery from the diseases. Is that awesome or what? This study was done 10 years ago, and they're saying, hey everybody, your spine is messed up. You have to work on that hard to get that improved. You might need daily treatment, and you need exercises just to take care of the spinal misalignment. And in here they talk about how that works, how the spinal misalignments mess up the nerve circuits that go to the adrenals, that go to your blood vessels, that go to your brain, that go to your organs, which creates this whole problem in the first place. You get an overactive immune system, so it overacts to pollen, it overacts to dust, it overacts to dogs and cats, it overacts to trees. It's not the trees and the pollen and the dogs and the cats that's causing your allergy. No, it's your individual immune system's overreaction to those things in the environment that causes the symptoms. The cause of the problem is not, the solution is not removing all the dogs and cats and trees and pollen and dust. Not going to happen. We talked about those cases. The solution to the problem is getting your immune system to react appropriately to these situations. What a beautiful study this was. Atopic dermatitis and bronchial asthma patients are often medically treated with corticosteroids, antihistamines, and immunosuppressants, which can actually aggravate their symptoms in the long run. So if you use these common medications, if you're being treated for these things, says these researchers, you might get temporary symptom relief, but you're going to get worse. What about antibiotics? So we just have a couple of minutes left. Follow along here. What about antibiotics for these type of things? How is it related? Well, here's a study that I've talked about in the past. Antibiotics for treatment of acute respiratory tract infections. Decreasing benefit, increasing risk, and the irrelevance of antimicrobial resistance. So what this article is saying is we are overprescribing antibiotics for self-resolving infections, and we have to get away from this because it's causing a worldwide problem. And let's see. What this basically says is, I can't find it right now, but I know what this article says is treating viral respiratory infections, antibiotic prescribing for that should be 0. So if you get coughs and colds and stuff like that, and if they don't swab you, send it to a lab and determine if this is a viral or bacterial infection, you don't get an antibiotic. In almost all cases, it is viral. Antibiotics aren't going to work. So we just keep throwing, how many of you go to the doctor with a cough and a sniffle, and then you just get an antibiotic? Ear infection, antibiotic. Sinus problem, antibiotic, and so forth. So what they're saying in here is, no, that's way too much. And I'm just going to read this title quickly. Evidence that acetaminophen, Tylenol, in genetically vulnerable children appears to be a major cause of the epidemics of autism, ADD, and asthma. This article links Tylenol use to asthma. So, what are you going to do for asthma, allergies, and skin problems like eczema? Try chiropractic. Try eliminating dairy products. And if that isn't enough, we might need to eliminate gluten or maybe a blood test for food sensitivities, and including immune system boosting supplements such as fish oil, antioxidants, vitamin D, and probiotics. I'm Dr. Scott Fuller. Please join me again.